Hello, I'm Dr. Meera Raghavan, a senior consultant urogynecologist and robotic surgeon. Today we're going to look on about what fibroids are and how we treat them. Now, does anybody know what fibroids are? Fibroids are exclusively seen in women and they are benign masses which occur in the muscle of the womb. So, they're basically whorls of muscle tissue which happen in the wall of the womb and are known as fibroids. Fibroids can be totally asymptomatic or can cause a multitude of problems ranging from heavy periods, painful periods, prolonged periods, to the extent of causing pressure on the bladder, the rectum, or intending into the cavity of the womb, making it difficult for the woman to conceive, or even if they become pregnant, can result in miscarriages. Fibroids are also a cause for repeated infections in the pelvis or infertility which can happen in the woman because of the presence of these fibroids trying to cause pressure on the tubes or kink the tubes and thereby block the tubes as well. Fibroids are basically benign tumors, but should they present with sudden increase in size over a few months or present with acute pain, then there is a suspicion of malignant transformation within the fibroids, but this occurrence is such a rarity in the extent of 0.05 per thousand. So, in general, if you see, fibroids are benign masses and can be treated individually depending on what symptoms the patient is presenting with and what are the presenting complaints. As I said, if the patient is presenting with a periods related problem due to heavy periods, clots or painful periods, symptomatically they can be treated with medications which reduce the amount of bleeding or the pain. If the patient is not married or still wishing to have more children, we can direct the therapy against the fibroid alone and need not necessarily remove the womb. These fibroids can be individually removed either by minimal access surgery, both by keyhole using a laparoscope or a robot, where we remove the individual fibroids, which is called myomectomy, or by an open procedure. The main idea is to conserve the organ, which is the uterus, thereby enabling the woman to have further pregnancies or protect the womb for its support purposes. Should the woman have completed the family, or there is a suspicion of the fibroid undergoing malignant transformation, or there are multitude of fibroids and causing pressure effects, then a hysterectomy in these cases might be indicated. There are other methods which are non-surgical and minimally invasive to treat fibroids as well. For example, radiological embolization of the uterine fibroid. This is a minimally invasive radiological interventional procedure whereby, just like an angiogram, we catheterize the arteries leading on to the uterus and the fibroids. Under an MRI or an ultrasound guided procedure, we block the arteries and reduce the blood supply to the uterus or the fibroid. By doing so, we are cutting off the blood supply and the feeding to the fibroid, thereby they shrink in size and shrivel off and reduce the amount of bleeding, or luckily these women will not have any periods after that. Now, uterine artery embolization can be done for individual large fibroids which light up because of the contrast injected during the MRI and can be amenable to such procedures. Patient doesn't need to stay in the hospital beyond 24 hours. Is a fairly less invasive procedure. Pain management is done for 24 hours because it's pretty much cutting off the blood supply to the fibroid, and patient can be discharged thereafter. They are followed up with an ultrasound in 3 to 6 months time to see the level of shrinkage which happens in this fibroid, and also to keep a clinical check on how the symptoms are and how they are faring after the procedure. As far as minimally invasive hysterectomy or myomectomy is concerned, we do it either laparoscopically or with a robot procedure, whereby the woman does not receive a big incision. It's a keyhole procedure, and the minimum duration or maximum duration of stay is only 24 hours. They are more ambulant, less pain, and recovery is shorter and quicker. They are much more agile and be able to return to work within 10 days time. So, fibroids can range anything from being a small peanut size to humongous size of nearly 30-40 centimeters, occupying the entire abdomen, causing various problems for the woman, right from heavy periods to becoming malignant. It's about detection, it's about surveillance, it's about individualizing and customizing treatment depending on the needs of the patients and the symptoms. One size does not fit all. So today we've learned about fibroids, the occurrence, the symptoms and the treatment options available. Thank you.